Thank you very much and good afternoon. I would like to start today by recognizing the tragedy that we are continuing to experience. Earlier today, our coroner, BC's coroner, released the report on illicit drug toxicity deaths in BC in 2021. And as we know, our province has lost another 2,224 people to toxic drugs last year. These are our brothers, our sisters, our family members, our colleagues, our friends. And it is such a challenging thing to know that no matter what we do, it's still affecting all of us. I remain firm in my commitment from our office to do everything we can to continue to try and find ways to help people who use drugs, to reduce that shame and stigma that keeps people who use drugs from reaching out to their friends and their loved ones. And part of that is continuing to push Health Canada with the exemption so that decriminalization of people who use drugs is a key role that we can do. And as well, we're moving ahead and pushing on increasing access for people to a safer supply of drugs during this incredibly toxic time, especially now as we're seeing increased mixed drugs, including benzodiazepines, that makes it even more challenging to rescue people. It has also become very apparent that our two health crises are intertwined, and getting through this next phase and getting through the pandemic emergency of COVID-19 is also vital to helping us manage people who are caught up in our toxic drug crises. But please know you are not alone, and reach out to people, let them know, do not use alone, and we will get through this. We have also continued, as you know, to monitor our progress through this pandemic, including reviewing our orders on an ongoing basis. And as always, we are reevaluating all of the measures that we have in place, the data that we have that shows where we are in this wave as we move through yet another changing virus. I want people to know that all of these changes that we make to orders, to easing of restrictions, are done because of how we have worked together to get through this last 2 years. And I recognize, and we see this all around us, we're all tired of this. We want it to end. But wanting it to end and taking the right measures to get us through this are two different things that we need to work on together. And I want you to know that the changes that will be made will be continued to be based on the science, the circumstances of our pandemic here in British Columbia, and a direct result of the millions of people in BC who have done and continue to do everything they can to protect themselves, their neighbors, their communities. And that's how we will get through this. It has been a long, changing 2 years as we adjust to the curves that this virus has shown us. But the reasons we are coping right now with this Omicron wave, again, a different virus that has been challenges in different ways for us, is because we are continuing to support each other as families, as communities across this province. The public health tools we have been using, like case and contact management, and the type of testing that we're doing, those have had to change, and that is challenging. It's hard for us to change our tactics as we're going through this changing environment as well. But we continue to use those measures that work for us individually and collectively, whether it's making sure that you're vaccinated, getting your booster dose, making sure you're staying away from others if you're feeling unwell, washing your hands regularly, all of these things, wearing masks when we're in indoor public places. These are all things right now that are going to get us through this wave. And as we are transitioning, we will get to that point where we can have a sustainable management strategy. We're working through the details of this, following every day what we are seeing in our hospitals, what we're seeing in our communities. And we'll be sharing specifics in the next week. As you know, the number of the orders are expiring next week, and we will continue to monitor those. What you will hear next week will be the details of how we're going to be moving forward. You will hear less about the pandemic as we get through this wave, and more about how we continue to manage our personal risks as restrictions are adjusted in step with what we are seeing in terms of transmission and hospitalizations. As well, we'll be modifying our surveillance reports and looking at what are the important things that we need to monitor and what's the time frame we need to monitor those in. As you know, we've changed our testing strategy to focus on those people who need a test because it affects their health management or because it's important for them in terms of returning to work. And because of that, a couple of the metrics that we've been reporting on daily, particularly the ones about active cases and people who have been removed from isolation are no longer accurate, and they're no longer an accurate reflection of what's happening in the community. So those ones will be removed from our daily surveillance reports and off of the dashboard on the BC CDC website. Again, it's a change because of the changing strategies and how we're dealing with what we're faced with right now. It's important not to lose sight of the fact that COVID-19 continues to be a serious respiratory illness, and we will be focusing on that and needs to be treated as that. And the virus is not going away. We can expect that it will change in the future. We only need to look at the amount of transmission around the world and what has happened even in the last few months with the Delta wave and now Omicron to know that we are still at risk of having yet another variant arise that we will need to manage. And one of the most important things that we have now on our side is that tool of protection through vaccination. So we need to make sure that we are monitoring that and the effectiveness of our vaccine programs, the effectiveness of our boosters, and the immunity as we move forward. But we also know that we have a higher level of immunity now across BC because people have been immunized, and that gives us an opportunity to look at changes to how we're managing in the weeks ahead. A few days ago, the National Advisory Committee on Immunization provided updated guidance on vaccinations and boosters for people who have had a previous COVID-19 infection. And this is a complicated thing. There is no definitive right answer for what is the optimal time to get vaccinated after you've been had an infection. What we do know from real-world data, and we've said this multiple times, is that at least in the short term, people who've been infected with COVID-19, have had an infection, do generally have some degree of immunity that lasts for several weeks to months. But it is very variable, and we're seeing that more and more with Omicron as well, that people who are not vaccinated can have a very mild illness, and they may not develop both parts of the immune system. So the what we call the humoral immunity, the antibodies in our blood, and the longer lasting, stronger protection you get from cell-mediated immunity. So we do know, it's less clear for Omicron, how much protection and how long it lasts. We also know from immunology and vaccinology and what we know about the expanded intervals that it is important to wait a period of time between doses, and that helps that cell-mediated immunity become stronger and longer lasting. So the guidance really confirms the importance of, even if you have had an infection, that it is important to build up and strengthen your immune system for the long term through vaccination. So if you have not yet been vaccinated and you have been infected recently with Omicron or with Delta in the last few months, you can wait as long as 8 weeks until you start your immunization, dose 1s and dose 2s. Or you can wait 8 weeks between your first and second dose after infection. But what this does is it does mean you will have some degree of risk in that period of time. So it really depends on how much virus is circulating in the community, which strain of the virus it is, and also really important things like who you live with and what risk they might be if you become infected right now. So what we have been saying, what I have been saying all along, is that it is important that once you have recovered from infection and are no longer infectious to others, that you can receive your vaccine anytime after that. If you are somebody who's immune compromised or has risk factors for severe illness, that is when you should get your vaccine. And this applies to booster doses too. So if you are at 6 months from when you've had your second dose, regardless of whether you've had an infection, if you have those underlying conditions that make you more at risk, it's important to get your booster dose right away. If you are otherwise healthy, you can wait as long as 3 months after that infection. So all of this is slightly confusing. I will tell you that we have increasing evidence, and I talked about the puzzle that we were putting together around Omicron. We do know now that that third dose, that booster dose, does increase your protection, probably about 50 to 60% protection from infection with Omicron. So we know now that 2 doses does give really good, strong, longer-lasting protection against severe illness like hospitalizations that leads to hospitalizations or deaths. And that continues. But that can be boosted, and the protection against infection can be boosted with that third dose. So right now, with the amount of transmission that we're seeing, the advice that I give to people is that it is important to get that booster dose at 6 months right now, regardless of whether you've had a mild Omicron infection in the last few weeks. As we get to a place where there's less virus circulating, that advice may change, and it may be prudent or it may be okay to wait a little bit longer. But I would encourage everybody, when there's a lot of virus around, vaccination helps. So get it when you recover, whether that's your dose 1, your dose 2, or at 6 months, your booster dose. As I mentioned, we're revising our orders, and we've been working with industry, particularly the food and beverage industry, and I just want people to know we will be posting additional guidance under the food and liquor serving premises order, basically at the request of industry to support businesses that don't normally serve food. So that's bars and nightclubs in general. And from the very beginning, they have been able to repurpose their business or reorient their business to serve food. There's been more interest in that in the last few weeks since we changed the orders around liquor serving premises. And so we've been working on this consultation with industry, and we'll be providing the clarification of what they need to do to be able to serve food in those premises. As well, in follow-up to the notice that was given in October, we are moving ahead with the new order in place for regulated health professionals. I have spoken many times about the importance of all of us as healthcare professionals doing everything we can, and it is our obligation to make sure that we're taking all of the measures to protect those patients in our care, especially the more vulnerable people that we serve. As well, it is important for us to protect our own health as part of being able to continue to contribute into the healthcare of others during this challenging time. It is our responsibility, and it continues to be our responsibility, and vaccination is part of that. In the fall, as you know, we put orders and measures in place for all healthcare workers working in long-term care, acute care, and community health settings. And for several months now, we've been working with the health professional colleges to sort through the details of that vaccine requirement that we gave notice on in October. It's ensuring that we have a consistent supported standard across healthcare so that all regulated health professionals are held to the same standard. And so I had given notice in the order in October that we would give a date when that would be required. And so that date will now be March 24th, 2022. We're taking a phased approach so that those few individuals who are not yet vaccinated are able to have that opportunity to get their vaccines. And there is a process in place for medical exemptions that can be submitted to my office. Colleges will then work with the registrants who are unvaccinated to support them through this process. So those orders will be in place starting next week once we've had the final consultations with the colleges. I think this is a really important measure that brings the same standard to all healthcare workers across the province, and is one of the most important measures that has allowed us to manage through this Omicron wave, where we have seen such a high rate of high number of hospitalizations, and will help protect us from the unknowns that are certain to happen in the coming year. We are getting through this pandemic, but we are not through it yet here in BC or globally. We are progressing because we are looking out for each other, taking care of each other, and because we have that definitive tool of vaccination. We are weathering this Omicron storm. It is because of the high level of protection we have from the immunization in British Columbia and from the measures millions of people in this province are taking every day. This has meant our healthcare workers have had milder illness so that we're able to get back to work. And while the rates of hospitalization and the rates of people dying have been much, much less because of vaccination and the severity of illness from Omicron, what we continue to see is that absolute numbers are still staggering. And we see that in with the high number of people who still have dying from COVID right now. And it is still affecting people differentially. People who are unvaccinated, our elders and seniors, continue to be overly represented in severe illness and deaths. We are not in the same place everywhere in BC. We know that this wave has passed through in the lower mainland ahead of other parts of the province, and we are still stretched very thin. We are also in a different place than many other jurisdictions, both globally and across Canada. And we will continue to monitor our situation and adjust our measures here in accordance to what we're seeing. But I also know that we are very proud at how we are working together to keep our businesses open across the board, keeping schools, childcare centers open, and we will be in a better place very soon. This will be a gradual process, finding that balance over this next phase of transition in the next few months and weeks. But we can look to tomorrow with hope and optimism and continuing with kindness and with care. Thank you.
Thank you very much, Dr. Henry. And I wanted to provide an update on vaccination on rapid tests, on surgical renewal, and on the impact of sickness on our healthcare system and on healthcare workers. With respect to vaccination, as I say, we're now at the point of over 11 million administered doses in BC, which is an extraordinary achievement of healthcare workers, of all of the staff surrounding and supporting our immunization efforts, of pharmacists and community pharmacy, of people who came and got vaccinated in their massive majority, more than 93%, less than 7% of people who now, of adults, less than have only 7%, 6.8%, I think, have not received their first dose immunization from COVID-19. So it has been a joint effort, and it's an extraordinary effort. What we've seen for all adults, for example, is 93%, as I say, 93.2% first dose, 91% second dose. Now well over 50%, 54% have received their booster dose amongst all adults in BC, and those numbers are growing every day. I had the occasion this weekend to visit two vaccination centers over a couple of days and talk in advance before the doors open to the healthcare workers and those supporting them at vaccination centers everywhere. I talked to a naturopathic doctor who's been vaccinating at the Italian Cultural Center throughout the pandemic, who's vaccinated people. The youngest person he'd vaccinated was 5, the oldest was 106, and how moved and inspired he was by his participation in this extraordinary public health effort. All I can do is express my gratitude to people of BC, to healthcare workers of BC, and our teams around the vaccination centers who've done an exceptional job. Thank you, thank you, thank you. I wanted to bring an update on the impact of sickness on healthcare workers and the healthcare systems. Health authorities continue to closely monitor sickness levels across health services, especially in hospitals, in long-term care and in home support. I can report from that the week of January 31st to February 6th, 17,158 healthcare workers called in sick. That is down slightly from the previous week, where the number was 17,756. That's 3,768 in Fraser Health, 3,389 in Interior Health, 1,702 in Northern Health, 1,713 in the Provincial Health Services Authority. That includes BC Emergency Health Services, 2,450 in Vancouver Coastal Health, 3,427 in Island Health, and 709 in Providence Healthcare. I want to express again my gratitude to all those healthcare workers for their endurance and skill in meeting this challenge, which is an extraordinary one for people across the public healthcare system. I want to provide an update on rapid tests. We expect to see by the end of February, so they're not here yet, 25,652,000 rapid tests arrive in BC. 25,652,000. Clearly, the supply of tests to BC is ramping up quickly in the 2 weeks ahead. We need to continue to ensure easy access to rapid antigen tests for those at higher risk for COVID, to ensure timely access to treatment, and we will be taking measures to protect some of the supply to meet their needs in the weeks and months to come. However, with the expected increase in supply, we will be working over the days to come on a larger distribution approach, and we will have more to say about that in the next week or so. As of February 5th, 2022, BC had received 12,444,000 rapid tests, including 2,070,000 that arrived in the last couple of days. 6,575,732 tests have been deployed to key strategic areas. That leaves a current inventory of 5,869,000 tests. Over the next 2 weeks, so they're going out now from February 8th to 19th, subject to the timely delivery and the future delivery, but these rapid tests in particular have arrived. We will be delivering 4,130,000 test kits in addition to what's already been delivered. So that's 400,000 to COVID testing centers to replenish supply, 860,000 to visitors and symptomatic staff in long-term care and assisted living. That's part of our continuing effort, in addition to existing supply. 100,000 to resupply acute care centers for symptomatic healthcare workers and health authority programs. 240,000 to rural, remote, and Indigenous communities. 1,300,000 more test kits to support K-12 education. 780,000 to post-secondary education. The remaining tests will be distributed to point-of-care screening program and health authority programs. Again, we'll be providing more details on how we deal with the next. That will take us past 11 million of the 12 million we have now. And then with the additional that are coming, we expect coming in the next couple of weeks, we will have more details on our much larger distribution plan in the coming week. And now just an update on surgical renewal. Health authorities report that 6,231 surgeries were completed from January 9th to January 15th. From January 30th to February 5th, the most recent period, health authorities postponed 548 non-urgent scheduled surgeries. That's 72 in Fraser Health, 400 in Interior Health, 62 in Island Health, 5 in Northern Health, 9 in the Provincial Health Services Authority. We're seeing across BC, and we continue to see, the impact of COVID-19 on our staff, and I want to particularly note the efforts in Interior Health. You'll note both in terms of healthcare worker days lost, but also in terms of surgeries canceled. That's where we're facing some of our biggest challenges, and where the staff at Interior Health continues to go above and beyond the call to work on behalf of all the people in the region. And we are very appreciative and admiring of those efforts from Susan Brown on down. Cumulatively, from September 5th to February 5th, regional surges of COVID-19 and factors, including severe weather patterns, have caused 7,277 surgical postponements. When it comes to our healthcare system and supporting it, we've said on a number of occasions that our work is not done. And today's surgical renewal update fits that same bill. Our work is not done. when it comes to stopping COVID's rapid spread. Our work is not done because our work makes a critical difference. There's a lot of talk, I think, and some talk about changes that may be coming and how and why such change would be happening when we succeed in British Columbia. And when we've succeeded, it's because we've worked together. All of our successes as a province, all of the efforts we've made to support one another have made a difference. In BC, I think, we're one of the leaders in the world in vaccination. We have consistently, as a people, and everyone points to exceptions, but consistently followed public health guidance and public health orders and supported one another in these times, and it's made a difference. So when we make announcements that allow us to do things we may not have done before, it's because of those people in particular, the 93% of people with their first dose immunization, the healthcare workers who have gone above and beyond the call and have given everyone the best possible care in the world against COVID-19. Our record in critical care shows it. It is outstanding. These are things that we've done together, and what makes it, when we do have successes, what makes those successes special is because we did them together. And I want to thank all of you today and say that when we look at this and we look at changes that come, and whether we like those changes or we don't like those changes, the successes we have are our successes, and we need to continue to build on that spirit as a province, as a people, and as a healthcare system in the days and the weeks and the months to come.